Two communities just 2 miles apart, yet the life expectancy of people who live in them is more than 5 years apart. To improve health outcomes for all its residents, NHS Tameside and Glossop has forged partnerships with other health providers and local authorities to jointly prioritise, fund and commission projects that make a real difference to communities with very different needs and aspirations. In Tameside, partnership working has been reinforced by the joint appointment of Melanie Sirotkin as Director of Public Health and Strategy.
I have joint responsibilities for public health both for Tameside Metropolitan Borough Council and for NHS Tameside and Glossop, the Primary Care Trust, which means that my responsibility for the population and trying to ensure health improvement is the same across the two areas. We have an agreed set of objectives for the population that are shared, and that means we can achieve more together.
At the Fairfield Children's Centre, joint working has been taken to a new level. Health visitors, midwives and children's services have come together under one roof to support teenage mums, often from vulnerable or deprived communities. For the professionals, this partnership working has meant better relationships and a more efficient use of time. Christine Bassett from Tameside Hospital Foundation Trust, another of the PCT's partners, says most important are the benefits for women.
They're seen antenatally by a midwife with a special interest in teenagers, who then automatically, with their consent, refers them to Connections and to the children's centres, who can then begin to put plans in place to support them through their pregnancy, support them after birth. It's a seamless service. That's what we're aiming for, really, instead of 3 separate ones.
16-year-old Jasmine and 19-year-old Cara were among the first to benefit from the service, which it's hoped can now be extended across the PCT area. Joint working has meant they met the right people and received the right services at the right time for them.
Everything's in the same place, so you're not going to different places, and like the health visitors and the midwives are all here. It's really important because I've moved from a different area and I've not really known anyone around here, and I get to meet other mums that are going through the same thing as me.
This new health centre in Ashton was commissioned to bring GP, dental and community services together under one roof. A similar developments planned for Glossop, opening in 2011. That initiative has cemented joint working relationships between the PCT and Derbyshire County Council. It's expected to improve health and help regenerate the whole area.
There'll be a very good local health service, but it will also regenerate part of the town. It's about actually giving people confidence, giving the community confidence that, you know, something is good, something is big happening in their place. Somebody's prepared to invest money in their place, and it just stimulates well-being in people's minds.
In Glossop, there are also plans for a joint appointment to support public health improvements and commissioning across the PCT and the council. It comes in the wake of a new dental centre like this one that's already proved the benefits of joint working and commissioning to officials here.
People were struggling to get NHS dental care, and so, you know, the PCT listened. The PCT responded. We've got that new centre that's, you know, a flagship for provision across the rest of the county.
In Tameside and Glossop, strong partnerships, joint working and world-class commissioning are all designed to provide an efficient and seamless service.
As a starting point is about having a joint understanding about what's important, and then almost divvying it up in terms of who's responsible for doing what, and not being precious about the resources that actually sit behind that. The PCT will lead on things like mental health, and we will sort of support them in that work. We will lead on issues such as drugs and alcohol, and they will support us in that work. Good example is around crime and disorder. We've delivered a 27% reduction in crime over the last 3 or 4 years. Melanie Sirotkin, Director of Public Health, actually leads on violent crime. It's about that seamless delivery of service.
I think we've got a really good basis on which to build. I see us developing that further, aligning our resources more closely, focusing on areas where we've got biggest need, thinking about how we work with our practice-based commissioners and our GPs to look at how they might work in neighbourhoods and how we can bring our whole neighbourhood working together so that we've got local targets.
For the PCT and all its partners, joint working is at the heart of a world-class commissioning strategy and at the heart of its determination to deliver better services and better outcomes for all.